Every year, many Americans over the age of 70 line up for all kinds of tests and imaging, believing they are preventing disease and doing everything they can to avoid stroke and cancer. But what few people clearly say is, some of those tests do not help you live any longer and can even open the door to surgery, complications, and in some cases, cancers caused by the tests themselves. Many studies show that a significant portion of tests in older adults fall into the not truly necessary category, while most people over 70 have no idea they are being over-tested. For CT scans alone, some estimates suggest they may contribute to a portion of new cancer cases every year, just from those checkups for peace of mind. In this video, we will look at 5 types of health checkups that, after age 70, you should think very carefully about before doing, because sometimes they cause more harm than good. All of this is based on scientific evidence, current recommendations in the US, and real-life stories from older adults themselves. You're watching the VitalAge Health channel, where we share trustworthy medical knowledge to help you live long, stay healthy, and be happy. Checkup #5. Bone density scan. More worry and medication than benefit. Once we understand the big picture, let's start with the first test, which sounds like the most harmless. The bone density scan. A bone density scan, or DEXA scan, is often introduced as a quick, painless test with no needles, where you just lie still for a few minutes to find out whether your bones are weak. That sounds very reasonable, especially for women after menopause. But after age 70, for many people, the result from that machine can bring more worry and more medication than real benefit. Why is that? Because bone loss to some degree is a natural part of aging, just like graying hair or wrinkled skin. If you compare a 7-5-year-old body with the standard of a 30-year-old, almost everyone will have osteoporosis or at least osteopenia. And once the number on the paper labels you as having weak bones, many doctors will quickly prescribe bisphosphonate medications to protect your bones, even though your actual fracture risk may not be that high. These drugs can help some people who are at very high risk, but they also come with unpleasant side effects like acid reflux, burning in the esophagus, jaw pain, and in a small group, a very frightening complication called jawbone necrosis. Picture the story of Rose, 76, who lives in Florida. She walks every morning in her neighborhood, does her own gardening, and has never had a fall. At a routine checkup, her doctor ordered a DEXA scan. The result? Osteopenia. Right away, she was given a weekly pill to keep her bones strong. After a few months, Rose started to have heartburn, chest burning, and discomfort in her jaw when she chewed harder foods. She was afraid of breaking a bone, so she kept forcing herself to take the pills. But she felt tired and lost sleep because of the pain. Only when she saw a geriatrician did someone explain that for a person who is still walking well, not falling, and has never had a fracture, the important thing is not the T-score number, but muscle strength, balance, and lifestyle. They decided to stop the medication and focus on vitamin D, eating more calcium-rich foods like yogurt, cheese, sardines, and leafy green vegetables, combined with walking, light weight training, and balance exercises. A year later, Rose hadn't had a single fracture. She walked more steadily than before, and most importantly, she felt in control of her health instead of being haunted by a number on a screen. So, after age 70, instead of rushing to repeat scans every few years only to end up taking another pill, ask your doctor, am I truly in the high-risk group for fractures? Can I focus on exercise, nutrition, and fall prevention first? Often, strengthening your legs and improving your balance is a more effective medicine for protecting your bones than any number on a DEXA report. And if a test that seems simple can lead you into years of medication, just imagine what might happen with another kind of scan, a brain scan, when you've only started to be a bit forgetful. Before we go deeper, I'd like to hear from you. Which country are you watching from? Have you ever gone through a medical test that you later wished you hadn't done? Please share in the comments. Checkup #4. Brain MRI for mild forgetfulness. More worry than benefit. After age 70, almost everyone has moments of sitting still for a few seconds because they forgot what they were about to do. Forgetting the name of a neighbor you haven't seen in a long time. Forgetting which level you parked on in the garage. Telling the same story a second time and not remembering you just said it yesterday. Those moments can easily make you panic. Am I starting to get Alzheimer's? Am I about to lose my memory? In that fear, many people quickly ask their doctor for a brain MRI, believing that if they can just look inside the brain, they'll get a clear answer. But the truth is different. In people over 70, if you go get a brain MRI, there is a very high chance the scan will show something: a few small white spots, some mild atrophy, lines of dents, hard to understand descriptions. For specialists, many of those changes are simply normal aging of the brain, just like graying hair or wrinkles. But for patients and families, words like white matter lesions or mild brain atrophy sound terrifying. From a bit of normal forgetfulness, suddenly you carry the feeling that my brain is slowly breaking down. Think of Michael, 74, living in Arizona. He used to drive himself to play golf, go to church, and sometimes forgot where he put his keys, but he remained completely independent because they were worried. His daughter took him for an MRI. The report mentioned age-related white matter changes. No one explained clearly, so he searched on Google and became convinced that he was developing dementia. He stopped driving, saw his friends less, and withdrew at home. A few months later, his memory really did get worse. Not because his brain suddenly declined that fast, but because fear led to poor sleep, less activity, and losing the social and mental activities that keep the brain sharp. Only when he met a geriatrician and did some simple memory tests in the office did he learn that he was still within the normal range for his age. What he needed was adequate sleep, enough fluids, daily walking, and staying socially engaged, not another MRI scan. This doesn't mean a brain MRI is always useless. If you suddenly have a change in personality, slurred speech, weakness on one side of the body, seizures, abnormal walking, or your memory drops off very quickly in a short time, those are red flags that need urgent evaluation, which may include an MRI. But for mild, occasional forgetfulness, when you're still managing your daily life on your own, the safer and smarter step is usually simple memory testing in the clinic, reviewing your current medications, sleep patterns, depression, and nutrition. Often, the thing that needs to be scanned is not your brain, but your daily routine. And if one MRI can pull you into a spiral of anxiety and unnecessary testing, then, with the heart, an organ that is already sensitive after 70, checking just to be sure with a stress test can sometimes take you even further, straight into the cardiac catheterization lab. Checkup #3 Cardiac Stress Test. The doorway to stents and heart procedures. Heart rhythm is what worries many people most after 70. Just feeling more tired while climbing a hill, a little chest tightness, or simply not as strong as before is enough for many people to be sent for a cardiac stress test. You're asked to walk on a treadmill or receive medication that makes your heart beat faster, while machines monitor your EKG, blood pressure, and sometimes blood flow to the heart muscle. It sounds very scientific and reassuring. If there's a blocked artery, the machine will detect it. But for many people over 70, especially those who are just a bit generally fatigued without clear symptoms, this test opens a door to a series of invasive procedures whose benefits are not always clear. The problem is that in older adults, stress tests are much more likely to give false positives. The machine flags an abnormality, but the coronary arteries are not actually blocked badly enough to require intervention. And when the result doesn't look perfect, the next step is often catheterization to visualize the coronary arteries, then a stent, then blood thinners, more hospital days, and more risks such as bleeding and kidney injury from the tenet. Contrast dye. All this when what you wanted from the beginning was simply to know why you feel more tired when you walk. Imagine Raymond, 75, a retired postal worker in Ohio. He still walks around his neighborhood every day, but sometimes feels more tired going up hills with no clear chest pain and no severe shortness of breath. At a visit, his doctor suggested a stress test, just to be safe. The results said possible myocardial ischemia, so he was sent for a coronary angiogram. A mild narrowing was found and quickly stented. That night, he reacted to the contrast dye. His kidney function worsened, and he had to stay in the hospital for almost a week, feeling more tired and more anxious than before. A few months later, when another doctor reassessed him, they realized that his original tiredness was mainly due to low fluid intake, poor nutrition, poor sleep, and trying to maintain the same walking pace he kept at age 60. The real problem was lifestyle, not severely blocked arteries. This doesn't mean stress tests are always useless. If you have clear chest pain with exertion, worsening shortness of breath when walking short distances, or a sudden and unexplained drop in your ability to be active, your doctor may use a stress test as part of the diagnostic toolkit. But if you're just a bit more tired with heavier activity, while still functioning normally and walking your usual routes, sometimes the better approach is to check your blood pressure, do blood tests, a resting EKG, and adjust your diet, sleep, and activity level. In other words, worrying about your heart does not mean you must immediately get on a treadmill. And if one heart test can push you into a costly chain of procedures that may not extend your life, a gastrointestinal test like colonoscopy, when done at the wrong time after age 70-75, can also turn a healthy person into a hospital patient in just one day. Checkup. #2. Colonoscopy. When should you stop after age 1 scop? 70-75? Colonoscopy has long been considered the gold standard for preventing colorectal cancer. The scope runs along the entire large intestine, detecting and removing polyps that have the potential to turn malignant. For middle-aged adults, this can bring huge benefits. But after age 70, especially after 75, the story begins to change. The extra benefit from each follow-up colonoscopy is no longer as large as before, while the risks of the procedure increase clearly because the colon is more fragile, and the heart, kidneys, and brain are more sensitive to anesthesia, laxatives, and dehydration. The preparation for a colonoscopy is not light. You have to drink a large volume of laxative solution to clean out the bowel. For younger people, that's just an uncomfortable night. But for those over 70, especially if they are taking blood pressure medications, diuretics, or heart medications, rapid fluid loss can cause low blood pressure, dizziness, falls, or make the kidneys unhappy. In the endoscopy room, sedatives help you sleep through the procedure, but also raise the risk of confusion afterward, heart rhythm disturbances, or prolonged low blood pressure. Not to mention rare but serious complications like bleeding or perforation of the bowel, things that a frailer body will struggle to recover from compared to at age 50-60. Picture Dana, 73, in California. She is healthy, still on her feet every day running a small family bakery, with no weight loss, no bleeding, and no change in bowel habits. She had already had 2 colonoscopies in the past, both clean. This time, a new doctor advised her to repeat the exam for peace of mind because it had been a while since her last one. She agreed. During the removal of a small polyp, an area of weak bowel wall was damaged. That night, she developed severe abdominal pain, ended up in the emergency room, spent more than a week in the hospital, lost weight, felt exhausted, and nearly lost all her strength to return to work. Ironically, from the beginning, she was not in a high-risk group that truly needed another colonoscopy. This doesn't mean every colonoscopy after 70 is wrong. If you have rectal bleeding, unexplained anemia, black or red stools, unexplained weight loss, or persistent abdominal pain, those are signs that your body is crying for help. And endoscopy can save your life. But if you've had multiple colonoscopies before with good results, are in stable health, and have no symptoms, your doctor can absolutely work with you to consider stopping invasive screening or switching to simple stool-based tests you can do at home with no anesthesia and almost no risk. In other words, after age 70-75, the wise choice is not to crawl into the scope every few years, but to choose the right timing and the right reason, instead of scoping just out of habit. And if colonoscopy, a test originally designed to prevent cancer, can sometimes harm someone who is otherwise, well, then the next test is even more controversial, the full-body CT scan. A single scan from head to toe for peace of mind can sow seeds of future risk you never expected. Checkup has shown. Full-body CT scan. Scanning your whole body and the hidden price. In recent years, in many large U.S. cities, packages like Executive Health Check and VIP full-body scan have appeared. Pay a few $1,000s and you'll be scanned from head to toe with CT or other modern imaging machines. The ads sound very appealing. Detect cancer at a very early stage. Don't wait for symptoms. One scan for peace of mind. For life. For people over 70 who have seen friends die from cancer. That message touches their deepest fears. But behind that brief feeling of reassurance lies a hard truth. Full-body CT scanning in people with no symptoms has not been proven to help them live longer, while it definitely increases radiation exposure and the chance of being dragged into a cascade of unnecessary tests, biopsies, and surgeries. Each CT scan exposes your body to a significant dose of radiation. When you're younger, the body is better able to repair DNA damage. After 70, that ability declines, meaning the tiny errors caused by radiation are more likely to stick around over time. If you need a single CT scan to diagnose an emergency condition, the benefit clearly outweighs the risk. But when you take a healthy, symptom-free person and put them through a full-body scan just to find something, the scale tips the other way. The more closely you look, the more likely you are to find harmless abnormalities. Small nodules in the lungs, cysts in the liver, mild calcifications in the kidneys, all of which are very common in older adults and often would never cause any problems for the rest of their life. Yet once these are written in a report, they suddenly become suspicious, need follow-up, or need biopsy. Listen to Marcus's story, 80 years old, who used to teach gentle martial arts classes for older adults in California. He felt healthy and kept teaching every week, but his son was worried and gave his dad a premium full-body scan package for his birthday. The result? A 3 mm nodule in the right lung. He was referred to an oncologist, had a PET scan, and then a biopsy. That biopsy collapsed part of his lung. He was hospitalized, coughing, short of breath, and had to stop teaching the classes he loved. In the end, the nodule turned out to be benign. The only things that premium checkup gave him were 2 months in the hospital and a lingering fear of cancer, even though he had been living a joyful and active life. The key is not to ban all CT scans, but to use them at the right time and in the right way. If you cough up blood, lose weight without explanation, have persistent chest pain, or other worrying symptoms, your doctors will know what images to order, which area to scan, and the minimum dose needed. But if you feel well and are only afraid that something is hiding inside, remember that a body over 70 does not need a machine to inspect every millimeter to be safe. What you need more is a trusted doctor, high-quality regular checkups, a healthy diet, good sleep, and relationships that keep your heart and brain active. Often, letting go of the urge to know everything right now is the strongest way to protect yourself. Conclusion: instead of more tests, choose the right tests. After going through each of these seemingly familiar tests, you may clearly see one thing. In medicine, especially after age 70, more is not always better. One bone density scan can turn into years of unnecessary medication. One brain MRI can plant a fear of dementia in your mind, even when your memory is still within normal limits. One stress test can open the door to stents and heart procedures that may not help you live longer. One colonoscopy done at the wrong time can turn a healthy person into a hospital patient. And one peace of mind full-body CT scan can sometimes plant future cancer risks. What you truly need after 70 is not to do every possible test, but to choose the right test for the right reason at the right time. Before any recommended test, you have every right to ask your doctor 3 simple questions. How could this test change my treatment? If the result is abnormal, what will the next step be? And are there procedures or surgery that might follow? And, given my age and health, are the real benefits of this test greater than the risks? A good doctor will not be annoyed by these questions, but will respect you for knowing how to protect yourself. And please remember, the strongest foundation for prevention is still very ordinary things. Simple but balanced meals, slow and steady daily steps, enough sleep, and warm conversations that keep you connected with family, neighbors, and your community. Machines and tests should be tools to support you, not the things that define your health. If what you heard today resonates with your experience or that of a loved one, please share your story in the comments so the over 70 community can learn together and protect each other from unnecessary risks created by anxious checkups. And don't forget to hit like and subscribe so you don't miss helpful health videos made just for people over 50.